For the purpose of demonstration, we're using ungloved hands. Placement of a Redsense catheter patch with a secure clip or Hemaclip. Remove the Redsense catheter patch from a sterile pouch. Remove paper covering the adhesive. Place the hub of the catheter, bloodline connection, and secure clip or Hemaclip over the sensor pad. Gently roll over the connection to make a tab and form a secure pouch. If any blood loss occurs, the blood will hit the pad and alarm. At the end of the treatment, find the pull tab, red pull tab, and gently pull back to separate. Gently pull back the sensor patch. Remove from the connection. You will also want to wipe the alarm unit itself and the fiber optic extension off with an alcohol-based disinfectant.